Why are some women afraid to have sex while they are pregnant? And how can women have sex while they are pregnant? These are the questions that are not talked about often. And many women who speak to their doctors while pregnant don't ask these questions. And as time goes on, all through a woman's pregnancies, in the first trimester of her pregnancy, because of the vomiting, because of nausea, because of tiredness, the sex drive could drop, the sex appetite could drop, and it could pick up in the second trimester. She could be more sexually active. She could be more intimate with her partner. There will be more caressing, more intimacy, more stimulation. But as the baby gets bigger, the sex drive drops. She's uncomfortable, always tired. As the baby grows, the weight, the tiredness. So during pregnancy, a woman goes through a lot, and also a marriage, a relationship goes through a lot. If you're a returning subscriber, I want to say I love you. Thanks for supporting me. Thanks for always being there. Thanks for commenting, sharing. I love you. I love you. And if you're watching for the first time, don't forget to smash that subscribe button and turn on that notification bell. So when I drop juicy content like this, you'll be the first to watch. Share this educational content to others so we can reach others and people may be empowered, both men and women, and the world will be a better place. What are we waiting for? Let's roll in. There are a lot of reasons why women fear having sex while they are pregnant, or why couples don't engage in sexual intercourse or intimacy during pregnancy or while their wife is pregnant. Point number one, some men don't like to taste breast milk. Number two, many people believe that the penis is going to enter the womb or hurt the child. Number three, some are afraid of preterm labor. Some are afraid of miscarriages. Some think the baby is going to drink the semen or the sperms. Some think it's unethical, it's immoral, it's not okay for the baby to be part of the intimacy going on between father and mother. And some believe that the baby could actually be hurt, deformed, and what have you. But there are some people who believe that it will make childbirth easy. Now, is it good to have sex during pregnancy? Oh, yes, it is. Are there benefits of having sex during pregnancy? Yes, they are. Should you be cautious while you're having sex during pregnancy? Yes, you should. There are some things you need to do or watch out for while you are pregnant. That would depend on your past medical history, on the risk of your pregnancy. If it's a high risk pregnancy, a low risk pregnancy, it will depend on the position. And trust me, you need it as a lady. I want to advise all the men to actually be there for their wives at that time. Be patient with them. A lot of men don't like some women who are pregnant, they have already started producing breast milk. And some men don't like to drink breast milk. But the truth is 90% of men who are married have tasted breast milk one day or the other. They have drank breast milk without even knowing it. They have tasted it, but they never knew. Because even after a woman has had kids and she'll stop breastfeeding, some women still have their breast producing milk. And the truth is, some men also don't want to have sex with their wives while they are breastfeeding the baby. In some cultures, they don't want it. They don't want the smell of the milk. They don't like to taste the milk. The belief is unholy, it's ungodly, it's immoral, it's not right. It's ethically not right. And I want to say it's not a very good approach. Childbirth and, pregnancy and postpartum is a very stressful time and a risky time in a woman's life. That stimulation, that romance actually brings you guys closer. So this is an appeal to our men. to be more intimate, more sensitive to the needs of your wife during that time. So, if you are afraid of miscarriage, sex cannot cause a miscarriage. There are a lot of people who say after sex or after an orgasm, the woman's body can release oxytocin, and that oxytocin can help in contraction of the uterus, and then, it can induce labor and the woman can have a premature baby. No, that is not correct. That's not true. Um, Always know this: the baby is in an amniotic sac filled with amniotic fluid. So know that the baby will not drink semen or drink sperms. It's not going to happen and it will never happen. Also know that the penis can never enter the womb, you know. And I know some people will say, what if the woman has a shorter vagina? It's not possible. It's not possible. So sex during pregnancy is needed. It's needed. All the fears you're having of hurting the baby cannot happen, except you have medical conditions that you should watch out for. You understand that you should watch out, and if you have to engage in any form of sexual activity, it needs to be gradual, and you need to talk about this with your doctor. Sex is important in soothing a woman for her mental health. It helps her calm down. It helps her be feminine. It prepares her all through that time to receive her baby at the end of 9 months or when the baby is to come. Remember that pregnancy is a very risky thing for a woman. It's very risky. Carrying life in you, it's another life in you, is something that it's a lot of sacrifice. Her body is no longer hers. Her body now works the way the baby wants it to work. She has to do extra things, extra sacrifices, just that the baby should be born in good health. So, how can you have sex while you are pregnant? The first is use different positions, especially as the baby is getting bigger. Use different positions and make sure you use a pillow, and you don't thrust into your wife as you used to when she wasn't pregnant or before pregnancy. You have to be calm, and when she says it's painful, pause, and then you change the position. Use a lot of pillows, change position, and I'm telling you, it's going to be enjoyable. Number two, use a condom if your husband has an STD or if you are not in a committed relationship. Remember, if you have an STD or if you contact an infection through sex or an STI, remember that that can cause an infection and it can lead to preterm labor or a miscarriage. You have to protect yourself during that time. It's a very, very sensitive time in the life of a woman. So, when should you get worried while having sex? When should a pregnant woman be worried when she's having sex? When there's prolonged pain, prolonged discomfort during sex, when you start passing out amniotic fluid or watery discharge, you need to stop, speak to your doctor. When you are having any form of anal or vaginal discharge or bleeding, go to your doctor. If you have had past experiences with delivery, for example, if you have had premature births, it's good you speak to your doctor before you engage in sexual activities, and let him advise you, let he or she advise you and how you can go about your sexual life with your partner. Also, if you have had an incompetent cervix, that means that your cervix has been closed or stitched. You need to speak to your doctor and let your doctor guide you on the positions and guide you when you can't have sex. And also, if you've had placenta previa, that means the membrane has been ruptured. You will need to speak to your doctor. But so far, sex during pregnancy is needed, is wanted, and it's very beneficial to the woman and even to the man as well. Because during that time, you will get to understand what it's like to carry life. It's a good bonding time with your spouse. It's a very good bonding time. It's a time when you'll be able to get reconnected, to talk about different things, and you have a blissful marriage at last. So thank you very much for watching. Till next time, I remain your seasoned medical professional, Gwendolyn Hallen.